You may not have given much thought to meningitis B, but maybe you should. Let's begin by explaining what meningitis is. Meningitis is a disease that attacks the membranes covering the brain and spinal cord, causing severe swelling. It can also cause an infection in the blood called septicemia. What causes meningitis? Meningitis is caused by a viral or bacterial infection. It can also be caused by certain drugs, injuries, or even cancer. Today, we're going to focus on bacterial meningitis. Bacterial meningitis can be fatal and requires immediate medical treatment. About 1 in 10 people who get meningitis will die, sometimes within 24 hours. Of those who survive, 1 in 5 will have permanent complications, including hearing loss, kidney damage, brain damage, and amputation of arms, legs, fingers, or toes. The 5 most common groups of the bacteria that cause meningococcal disease, also called bacterial meningitis, are A, C, W, Y, and B. Most of the meningococcal disease in the United States is caused by groups C, Y, and B. Meningitis B, caused by the group B bacteria, can strike suddenly without warning and be fatal. A sudden severe headache, high fever, and stiff neck are often the first symptoms of meningitis B. At first, these symptoms may feel like the flu. Other symptoms may include nausea, vomiting, light sensitivity, a dark purple rash, and confusion. It's important to remember that symptoms can progress quickly and be fatal. How does meningitis B spread? Meningitis B is spread through close contact with an infected person. This can happen through coughing and sneezing, sharing drinks or utensils, kissing, and living in close quarters. Anyone can get meningitis B, but college students living in dorms and others who live in group settings, such as military barracks, are at a higher risk of getting the disease. Can you prevent bacterial meningitis? Vaccination can reduce the risk of getting meningitis. There are 2 types of vaccines available in the United States: Men-ACWY vaccines and Men-B vaccines. The Centers for Disease Control and Prevention, or CDC, recommends Men-ACWY for all preteens at 11 to 12 years old and a booster dose at 16 years old. The Men-B vaccine is recommended for ages 16 through 23, but since the vaccine has only been available since 2014, not everyone has received it. Recent data from the Centers of Disease Control and Prevention shows that 7 out of 10 17-year-olds in the U.S. did not receive even 1 dose of meningitis B vaccination in 2020. Keep in mind, multiple doses are needed for the best protection. Some healthcare providers may not mention the vaccine, so you will need to ask for it. If you're a teenager or young adult missed getting either vaccine, speak to your healthcare provider today. Even if your teen received Men-ACWY, they still need Men-B.